Bismillahirrahmanirrahim. Dear students, I'm Dr. Ahsan Javed, and I'm recording this next lecture, which is emergency procedures and patient care. As you are all familiar that due to current emergency situation in coronavirus, due because of coronavirus, we are recording and delivering these lectures online. So I want your maximum participation in these lectures. I'll be recording these lectures as well as I'll be putting these lectures on the YouTube and the classrooms. And in addition, after recording these lectures, we'll be conducting live sessions with the same lecture being repeated. So we start with the class. Today's learning objectives are hemorrhage and its type. We need to understand what is a hemorrhage and what are different types of hemorrhage. Then pre-hospital management of the hemorrhage, perfusion and shock, management of shock, soft tissue injuries, open and closed wounds. We'll be differentiating between open wound and a closed wound, dressing and bandages and their application with the general population. Finally, special situations, injuries to the scalp, ear, nose, eyes, neck, abdomen, or genitals. These are special areas where if injuries occur, their management is slightly different from bandaging or dressing the other superficial areas. So we'll be try to cover these topics in this session, or maybe we'll divide the lecture into two sessions. So first we try to understand what is hemorrhage. Hemorrhage is simply the loss of blood from the body, and it can be an internal hemorrhage or external hemorrhage. When we say there is a loss of blood from the body, definitely there is a rupture of a blood vessel or some artery or a vein, or it can be superficial arteries, superficial veins also, and it can be capillaries also. So loss of blood from the body, it is known as hemorrhage. And there are two types of hemorrhages. One is, as the name depicts, internal hemorrhage, and other is external hemorrhage. By internal hemorrhage, we mean that the bleeding is from within the body. It is through the internal organs. It may not be evident on the superficial skin. And when we say external hemorrhage, it means the hemorrhage is or the loss of blood, it is visible on the surface of the skin, or it is visible from the skin due to rupture of the skin or injury to the skin. And when we consider the external hemorrhage, it can be, there are multiple types, and the wound is visible and the loss of blood is visible, as I mentioned before. It can be arterial, and the differentiating point for arterial hemorrhage or arterial loss of blood, or the blood which is on the skin after an injury, if it is of arterial origin, immediately after the bleeding it will be more bright red in color. So arterial blood is always more bright red in color. Venous blood is dark red, and it has a smooth flow. The difference between the blood which is coming from the body or from the skin, we may not be immediately identify whether it is arterial in origin or venous is in origin. The difference is in the color. The arterial blood, it is more bright red in color, whereas the venous bleeding, it is dark red in color. In addition, the venous blood is usually has a smooth flow, whereas arterial blood, it has a more like a pulsating flow, the way we can feel the pulse of the body. So if there is a major bleeding from an artery, it has a pulsating flow. There will be a sprinkle of blood, then a slight decrease in the pressure, then again an increased pressure, then decreased pressure. So it is more like a pulsating flow in case of arterial with a bright red in color, whereas in case of venous, it will be a smooth flow. Then third type of external hemorrhage is capillary, which is dark red, and again a very minute flow, and usually it is a smooth flow. Next is pre-hospital treatment for external hemorrhage. Apply direct pressure, elevate the injured extremity, use pressure points, use a tourniquet in case if you are unable to stop the bleeding with the previous three methods. So whenever there is a bleeding, you always have to apply direct pressure. And when by direct pressure, which means suppose if the bleeding is from the hand, you have to apply direct pressure over the wound area. And if you keep pressing this area for few minutes, the bleeding should naturally stop until or unless the person has some bleeding disorder. In that case, the bleeding stoppage of bleeding may be slightly delayed, or may the bleeding may not stop, or maybe a delayed stop in the bleeding. So first component is always apply direct pressure, and once you apply the direct pressure, the second step is elevate the injured part. If preferably the injured part should be elevated above the level of the heart. If it is below the level of the heart, there will be more blood flow towards the injured part. If you raise it above the level of the heart, suppose if the injury is at the hand, it shouldn't be hanging down. It should we should one should apply direct pressure, or the medical first responder who is attending the patient, by using the gloves and personal safety equipment first, will apply the direct pressure, then elevate the arm above the level of heart. And once it is done, it will reduce the blood flow to that area, and the bleeding can be, or hemorrhage can be, stopped. Then the third method, if you are unable to stop the bleeding by the above two mentioned method, the third method is apply the pressure over the pressure points. And by pressure point, we mean the areas where the arteries are more superficial. Like it can be carotid, it can be, in case of bleeding from the neck, it can be one carotid at a time. It can be uh, uh, upper and lower extremities. In case of upper extremities, it can be a brachial point, it can be a radial point if the bleeding is from the hand. So use the pressure points. So apply pressure to the areas where the arteries are superficial, or they are adjacent to the bones, and they can, by applying the pressure over them, the blood flow to the injured part with the hemorrhage can be reduced. Fourth is use a tourniquet. If you are unable to stop the bleeding with these three methods, the final step is to apply the tourniquet, which is a tight bandage. But its utilization, we'll understand in the next few slides, is very cautious. You have to take certain precautions. You have to try out all the three other methods of stopping the bleeding. And if still you are not able to stop the bleeding, then only then you can go for the tourniquet. Then finally, immobilize the extremity. Fractures may cause tissue damage. Immobilization can quickly control the hemorrhage associated with the injury. Suppose if there is a fractured bone, and obviously the fractured bone has injured the tissue also. So in addition to management of fracture, you have to stop the bleeding. If you apply the pressure, if you apply direct pressure, or if you use pressure points, as well as if you use uh, all the maneuvers of stopping the hemorrhage. If you are Once you stop the bleeding and you do not immobilize the extremity or injured part, what will happen whenever there is a movement? There is again a rupture of the initial clotting that has taken place. As a result, what will occur there? The bleeding will restart. So once you have stopped the bleeding, or you have at least you're trying to stop the bleeding, also at the same time or after stopping the bleeding, you immobilize the extremity, because if you do not immobilize, the injury may the bleeding from the injured part may again start. So using a tourniquet, use a tourniquet only in a severe emergency condition, when the other means of stopping the bleeding they are ineffective, and apply the tourniquet as distal as possible. If the person is bleeding from the hand, you have to apply the tourniquet as close to the hand as possible, because if the person is bleeding from the hand and you apply the tourniquet over the uh, near the shoulder, it means you are endangering the health of a whole arm by application of tourniquet. Because one reason for applying the tourniquet is stoppage of bleeding, but at the same time, what you are doing, you are stopping the bleeding, blood flow to the all the normal areas and normal tissues also. So if the tourniquet is applied, it has to be removed within certain duration, because if it is not removed during within certain duration, it will lead to may lead to tissue damage due to hypoxia and reduced blood supply. So you have to be very cautious, and once you have to apply the tourniquet, it should be as distal to the injury site as possible. Using a tourniquet, it can cause damage to the nerves, blood vessels. It can result in loss of extremity. So, as mentioned before, if there is no blood flow to that affected extremity because of application of tourniquet, tourniquet may also compress the extremity. As a result, there will be nerve compression, and eventually blood vessels will be compressed, and the bleeding can blood flow to that area can stop, and eventually if the tourniquet is not removed, it will lead to loss of extremity because of tissue damage. So as mentioned in the starting slides, there are two types of hemorrhage. We have gone through the external hemorrhage. The next category is internal hemorrhage. Internal hemorrhage can range from minor importance to a major life-threatening problem. The loss of blood can be seen in the internal, cannot be seen in the internal bleeding. So internal hemorrhage can be a minor problem, but it can be a life-threatening problem because you are not able to see the blood flowing. Because if you are able to see the blood flowing, you may take immediate actions or respond to that emergency situation. But if you're not monitoring the blood flow, you're not able to see the blood flow, what will happen? The patient may be initially stable, but as there is a massive bleeding into the abdominal cavity, into the lungs, eventually the person will be having a hypovolemia. There will be less blood flow through the arteries or the circulatory system. As a result, the person may experience the hypovolemia and may go into a condition of shock. So it depends where the internal bleeding is occurring or internal hemorrhage is occurring, and depending on that type of internal hemorrhage, there can be coughing up a bright red blood. Usually, it will indicate that the injury has involved lungs, or it has involved major blood vessels around the area of lungs, in the chest, in the thoracic cavity, or in the area of the neck also. So bleeding from these areas, it's accumulating in the throat, and eventually the person coughs up bright red colored blood. Then there can be vomiting a dark colored blood, which is also called the coffee colored. And when it occurs, it indicates that the person is having a upper GI injury or upper GI condition, which is leading to bleeding into the GI system. And usually it results in vomiting a dark red color or a dark red colored, coffee colored vomit, and it indicates upper GI injury. Then there can be minor injuries, small or large areas of bruising over the skin, maybe the skin of the hand or the extremities, both upper or lower extremities. It can be minor bruising over the area of thoracic wall or the abdominal cavity with no further complications arising. But in case if the area of bruising it keeps on increasing and there is increased rigidity of the abdomen, because the abdomen or abdominal cavity it is a hollow organ, but if the this hollow organ is filled with the bleeding, internal bleeding, eventually there will be rigidity of the abdominal cavity. So pre-hospital treatment for internal hemorrhage is maintain an open airway and provide high flow of oxygen as per local protocol or as per availability of the oxygen. So what you have to do, because you cannot see the internal hemorrhage, you may only identify or suspect internal hemorrhage if there is abdominal rigidity or if the person coughs up fresh blood or vomits dark colored blood, and only then you can assume that the person has acquired, in addition to external injuries, has also acquired internal injuries. And you have to maintain the blood airway open, and you have to, if the oxygen is available or if there is a local protocol of the organization to apply the oxygen, so you have to apply the oxygen. Why the oxygen is needed? Because you will be supplying more oxygen to the tissues. As a result, tissues will be more, their health will be more effectively maintained. Keep the patient warm. Do not overheat the patient. It means warm means only cover the person with a sheet or a blanket or a light blanket. It also gives a feeling of reassurance if that the person is being taken care of. In case if the person is having massive internal bleeding, which may be into the abdominal cavity, maybe into the thoracic cavity, maybe due to the fracture of the pelvis or the femoral head, there may be massive bleeding into the surrounding area. So the person, if the person is going into the shock or showing shock-like symptoms, you have to manage for shock, and you have to transport the patient as soon as possible to the hospital, because no further management of the patient can be seen or it can be done on the injury site. You have to report the possibility of internal bleeding to the EMS or emergency medical services, because when they arrive, they have to be prepared for managing a patient who is reflecting a shock-like symptoms. Now, as we are going through the internal hemorrhage and bleeding and external hemorrhage and tissue damage, there is a term which is known as perfusion, and the perfusion is circulation of blood through an organ or a tissue. And with the perfusion, what happens is the organ is perfusing when oxygenated blood is entering through the arteries and exiting through the veins. So by perfusion, we means that there is a constant flow of fresh blood through the arteries till the cellular level. Then there is an exchange of gaseous exchange and exchange of nutrients between the tissues and the flowing blood, and eventually this blood returns through the venous system. So tissue perfusion is flow of the blood through the arteries, then the return of the blood through the veins. So perfusion maintains the cell in the organ by giving them oxygen and other nutrients, by removing the waste products, and if perfusion fails, it will result in death of an organ. So perfusion, the main job of the perfusion is to maintain the cells in the organs, but providing them with the oxygen and nutrients. And once this oxygenation and nutrients are provided, the remaining blood it flows back through the veins. So if the perfusion fails, the tissue will eventually be deprived of the nutrients and oxygen, and this hypoxia and deprivation will lead to tissue death or the necrosis of the tissue. The next term is shock, failure of the circulatory system to provide adequate oxygenated blood supply through the body, inadequate tissue perfusion. So in case of shock, failure of the circulatory system to provide adequate blood supply throughout the body. If there is failure of the circulatory system in providing the required amount of blood to the brain, to the even to the heart and lungs and other tissues, it will lead to inadequate tissue perfusion. And in case of superficial tissues, there will be a shock-like presentation, and patient causes can be inability of the heart to pump enough blood through the organ. Due to the injury, the heart is damaged, or the electrical activity of the heart is damaged. In absence of electrical activity, there will be no mechanical contraction of the heart, and as a result, there will be no blood flowing through the body. So it is a cyclic mechanism. If one step is missed, there are certain compensatory mechanisms, but if these compensatory mechanisms also fail, it will lead to development of shock. And it can be due to inability of the heart to pump the blood through the organs. Severe loss of blood, insufficient blood in the system. There is massive bleeding, external hemorrhage or internal hemorrhage, and because of this bleeding or hemorrhage, what is happening, there is less amount of circulatory blood present in the circulatory system, which is to be pumped through the heart. And if there is less amount of circulatory blood, what will occur? There will be less amount of blood flowing to the brain, and once the brain is deprived of the blood flow, it will initiate an emergency response. The person will fall to the ground, may become unconscious because of lack of blood supply to the brain also. So any of the excessive dilation of the blood vessels, blood volume will be insufficient to fill them, and shock will develop. One another cause of shock is excessive vasodilation or dilation of the blood vessel due to certain usage of medications, due to certain psychological conditions in which there will be excessive dilation, or due to certain environmental conditions also. There can be excessive dilation of the blood vessels, and as a result, there will be less amount of blood returning to the heart, and eventually it will be leading to less circulatory volume and lead to a shock-like condition or a circulatory shock. So any of the above can cause oxygen insufficiencies in the body's organs. There are different types of shock, but the end result is the same. There are psychogenic shock, there are neurogenic, hypovolemic shock, or circulatory shock, but the end result is of every shock or shock-like condition is same. There will be inadequate perfusion to the organs. Signs of shock is breathing. It becomes shallow, rapid, more than 36 breaths per minute. We have studied that normal. In case of adults, the normal respiratory rate is 12 to 16 breaths per minute. But with the shock, the person who is going into a shock, the breathing will be shallow, but the respiratory rate will increase, and it may be rapid as up to 36 breaths per minute or more. Pulse rapid and weak because there is less blood flow to the brain. First mechanism will be increasing the pulse rate, but as there is less blood circulatory volume, eventually it will be weak but rapid pulse. Skin may appear pale in color, or when touching it may appear cold to touch. Face may become pale or may become cyanosed, and we have studied that cyanosis, if it is more apparent on the nose, on the lips, on the earlobes, it's reflective or the mucosal linings. It's reflective of central cyanosis. So face may be reflecting a central cyanosis. Eyes, they lack the life, they lack the luster or shine. Pupils, they may become dilated. So it means that the pupil will not be responding to light. Symptoms of shock, there is nothing first the responder can do to reserve the late stages of the shock, but it is possible to keep the patient from deteriorating until a higher level of help arrives. So medical first responder cannot, most of the time, cannot do much if the person is going into the shock. But what you can do is to delay the onset of the shock. And how it can be done by changing the position of the patient, by reassuring the patient in case of psychological, psychogenic elements or neurogenic elements are also there. So it can be multiple steps that can mitigate. It is most important to that the patient should be evaluated and treated to prevent the onset of the shock. So vital signs, they have a major role in assessment of such patients. Pre-hospital treatment for shock is maintain an open airway if the breathing is inadequate, administer oxygen because the person is breathing, but the breathing is shallow or it may be rapid. If the oxygen is available, you have to administer the oxygen. Prevent further blood loss by any of the methods that have been told you before, that you can apply direct pressure, you can elevate the injured part, you can apply indirect pressure over the pressure points. So, and in extreme cases, when all these three maneuvers fail, you can apply the tourniquet to stop the bleeding, further bleeding. And if you're able to stop the further bleeding, you'll be able to at least stabilize the patient for some time. Elevate the lower extremities by 20 to 30 centimeters, and by 30 centimeters, we mean that about 1 feet. So you have to elevate the lower extremity. Head should be lower than the legs and body. And this, what it will do, it will rush more blood to the brain. And if the brain is still getting the blood, it will um, continue to monitor the rest of the systems of the body. If there is no suspected spinal shock, the legs can be raised in case of suspected spinal shock. If the emergency services have arrived, by default, their emergency board is designed in such a way that head is by default lower than the body. Why it is so? It is to keep the person or keep the blood flow running to the brain when the person is going into a shock. So you elevate the extremities by 20 to 30 centimeters only if there are no suspected spinal, neck, chest, or abdominal injuries. If any of these injuries is suspected, keep the patient supine, face up, or can lift the foot end of the spine board. So any of the injuries, if they occur, what you can do is keep the patient supine on a spine board, and you can lift the foot end of the spine board instead of lifting the legs or lifting the pelvis or any other part of the body. Keep the patient warm, but do not overheat. It means you have to provide a blanket to the patient, provide care for specific injuries. Transport patient immediately, as early as possible or as soon as possible. Next is soft tissue injuries, commonly referred to as wounds. These are the injuries to the skin, muscles, nerves, and blood vessels. Um, and the soft tissue injuries can be open or closed. So in next section we'll be covering the soft tissue injuries, which are of two types. If the superficial skin is intact, it will be labeled as a closed soft tissue injury, and if the superficial skin, it is not intact, it will be labeled as a, or if it is intact, it will be closed, and if the superficial skin ruptures, it will be labeled as a open soft tissue injury, or a closed wound or a open wound, respectively. So I stop the session here, and once we go through the live interactive session, we will continue with the next session. I'll be stopping the recording also, so that we can continue with the session onward.